what we eat profoundly affects our health. Now, this statement should come as no surprise to any of us. We know this without having to attend a culinary university. But what makes a diet healthy? Actually, choosing a healthy diet can be very difficult. There are more than 50,000 different foods that a person can choose from each day. And we must not only select which foods to eat, but we must also consider how much of each to consume each day. Fortunately, there's not a single best solution that every person must adhere to in order to ensure good health. Rather, there are many different ways, making it possible to work within any person's particular likes and dislikes. At the most basic level, just two requirements, quality and quantity, must be satisfied in the design of a healthy diet. First, a diet must contain sufficient amounts of each of the 6 categories of nutrients: water, proteins, carbohydrates, lipids, vitamins, and minerals, which we described in segment 1 of this chapter. And second, a healthy diet must contain sufficient energy to support an individual's metabolic needs without containing a surplus of calories. But it's not easy to find the best strategy to satisfy these requirements. But the two keys, and remember this, are balance and portion control. Every 5 years, the USDA updates its established dietary guidelines to highlight and publicize the recommended intake of each category of food. Nutritional information on food labels lists nutrients according to the established USDA guidelines. These guidelines currently recommend 1, to keep your weight within the recommended range; 2, to be physically active; 3, choose a variety of fruits, vegetables, and grains, particularly whole grains, and non-fat or low-fat milk and dairy products; 4, keep your diet low in saturated fat, cholesterol, and total fat; 5, keep your diet low in sugars relative to complex carbohydrates and fiber; 6, keep your diet low in salt; and 7, if you consume alcoholic beverages, do so in moderation. Food labels are often an overlooked tool that can help in adhering to these guidelines and selecting a balanced diet. They actually contain a wealth of information. We'll talk more in class about labeling, and I'll share a couple of websites that might help you not only with your own nutrition, but also in such things as menu planning and the course in nutrition. In an environment in which calories are scarce, the drive to seek and consume food is adaptive. The more calories consumed, the better the ability to weather times in which food is lacking. The individuals who consumed more calories survived, reproduced, and became our ancestors. We as descendants have the genes of those who were driven to consume. Therefore, we are driven to consume. But in our modern environment, we rarely encounter famine. As a result, our extra calories remain stored, and we keep adding more. This chart is on page 876. 1 in 4 Americans is obese, which is defined as a body mass index of 30 or higher. This index is based on the ratio of body weight to height. Now, the system isn't perfect, as it doesn't account for muscle weight versus fat weight, but for the average person, it's a useful measure, and one that your physician utilizes to judge your weight. What are the consequences of being overweight or obese? Well, social issues notwithstanding, being overweight greatly increases the risk of heart disease, stroke, and diabetes, and these are known as the diseases of lifestyle. In adults, our increase in girth is primarily due to an increase in the amount of lipids stored in each fat cell. Now, in children and young teens, the increase in girth results in more fat cells being produced. Thus, overweight or obese children have the ability to store more fat as adults. And that's why there's been so much attention given in the last 5 years to childhood obesity. In the last 20 years, the diet industry has become a bazillion-dollar industry. Yet, the secret formula for losing weight is so simple and can be learned with just 6 words. Eat fewer calories than you burn. Or it can be turned around to state, burn more calories than you eat. And there are plenty of diet books available vying for the attention of dieters, each claiming to help take off the weight and keep it off. Actually, dieting is the least extreme of the weight loss options, which also include weight loss pills and surgical interventions. Drugs and other chemical interventions range from products that interfere with fat digestion to appetite suppressants to artificial fats and sweeteners that can't be absorbed. While all seem to work in the short term, their results are not much better than placebo, and their long-term effects remain to be evaluated. Surgery comes in two major forms: liposuction and gastric bypass or banding. In liposuction, the fat cells are literally vacuumed out of select areas of the body, and while this reduces fat in the short term, over time individuals undergoing this procedure tend to regain all of the lost weight. The most extreme option is physically reducing the size of the stomach and possibly shortening the small intestines. The effects of this are a reduction in the amount of food that a patient can ingest at one time due to the reduced size of the storage reservoir and a decrease in the surface area available for absorption. Both serve to reduce the amount of food brought into the body, and bariatric surgery works. Patients experience dramatic weight loss, and they keep it off in the long term. But this option is only for severe cases of obesity. Weight loss diets are the most common strategy employed for weight loss, but they have drawbacks as well. Studies conducted by both the National Institutes of Health and the New England Journal of Medicine concluded that good evidence does not exist that any of the major diet programs reliably lead to long-term weight loss. The failure of the major fad diets results from a focus on rapid weight loss rather than fat reduction, a reduction of muscle mass, rapid reductions in weight resulting in the body switching to emergency mode and enacting mechanisms aiming to preserve calories, and lastly, focusing more on eating habits while not including enough exercise. These problems also lead to nutritional deficiencies, a lower BMR, lower muscle mass and body fluid levels, and an increase in enzymatic activity that stores fat. So what type of diet would work? Well, careful monitoring of the amounts of calories ingested and reducing portions in a well-balanced diet instead of eliminating foods combined with regular exercise routines. Type 2 diabetes mellitus is another lifestyle disease, and its relative risk increases dramatically with an increased BMI. Diabetes mellitus, which literally translates to sweet urine, is a group of diseases in which the body's ability to regulate the blood sugar levels is disrupted. Many factors influence the level of glucose in the blood, but they mainly fall into two categories: those that add sugar to the blood and those that remove sugar from the blood. In diabetes mellitus, the major regulatory factor that removes glucose from the blood, that is the hormone insulin that's produced by the pancreas, is not functioning properly. This can occur in two major ways. One, the cells don't respond to the presence of insulin, which is type 2 diabetes as seen in this slide, or secondly, the pancreas doesn't produce enough insulin, which is type 1 diabetes that we'll see on the next slide. In both cases, more sugar is entering the bloodstream, mainly from the diet, than is being removed from the bloodstream, leading to a chronic elevation in the blood glucose level. Type 1 diabetes is influenced by genetic and environmental factors and usually develops in children. Type 2 diabetes is the more common, at least in those areas with a Western diet, with 90% of cases occurring in overweight and obese individuals. Type 2 usually develops after the age of 40, and it's sometimes called adult onset diabetes, but now it's being more frequently seen in teenagers. Chronically high levels of glucose in the blood have far-reaching health effects: loss of vision, circulatory system and kidney malfunction, as well as nerve damage. The treatment for type 1 diabetes is insulin injections and diet modifications. Injections directly into the blood are necessary because insulin is a protein and it would be broken down by the digestive system if we tried to take it as a tablet or a pill. Type 2 diabetics sometimes take insulin injections as well, but the recommended first step of treatment are a diet low in simple sugars, weight loss, and exercise. The low sugar diet will minimize the amount of glucose entering the bloodstream, and exercise will increase the amount of blood glucose burned to make energy. And weight loss will reduce the overall stress on the glucose monitoring system. Food poisoning is a misleading term. It isn't the food that makes us sick, it's the bacteria in the food that leads to the unpleasant symptoms. By adding spices, which are actually toxin plants produced to fight their own bacterial infections, to our food, we may be assisting our immune system in a battle against foodborne pathogens. This theory is based on three predictions. First, the magnitude of spice used in any part of the world should be related to the amount of microbial growth in that part of the world. Well, microbes grow best in warm, wet environments. And based on this prediction, spice should be used highest where the annual temperatures are highest. The data correlating 6,600 recipes from 36 countries is seen in this graph, and the trend clearly shows that the higher the average annual temperature, the higher average number of spices in the recipe. Second, spices with the strongest antimicrobial effects should be used the most, and the weaker antimicrobial agents used less frequently. 42 spices were tested for their antimicrobial effects. The four most commonly used spices, garlic, onions, chili pepper, and black pepper, all showed high antimicrobial effects. And the third theory is that meat recipes should contain more spices than vegetable recipes because microbe growth is faster and more common on meats. And true to the prediction, vegetable recipes called for an average of 2.4 spices, where meat recipes had an average of 3.9 spices. While research into this theory continues, the results obtained so far support the idea that humans incorporate spices into food preparation because of their antimicrobial properties.